Our top story, sweltering temperatures are being felt in Central and Eastern Europe this Monday as the unprecedented heat wave moves towards the Balkans and Ukraine, where it could hit 40 degrees Celsius this week. Meanwhile, with the cooler weather finally here in France, the country is starting now to count the human cost of the extreme weather. Officials say there were at least 1,000 excess deaths during the heatwave, and funeral homes have been struggling to respond. Charlie James has our report.
Across France, funeral homes are overwhelmed. At this mortuary in Paris, the owner has seen a 15% increase in deaths.
Over the past 48 hours, the number of phone calls and responses has risen significantly for our company and for our colleagues too.
Since Wednesday, the death toll has been climbing, and Monday, authorities reported at least 1,000 more deaths than normal. And that figure does not include all the people who died in their homes.
The figure of 1,000 additional deaths should be treated with great caution for now, because only deaths occurring in major healthcare facilities are recorded electronically. Deaths at home and in most nursing homes are documented using paper death certificates, which will be submitted to local town halls on Monday and won't be officially recorded until the beginning of the week.
The highest excess mortality rates happened in these western and central regions, and 85% of the victims were over age 65. The handling of this heat wave has become highly political in France. With hospitals strained and buildings not made for extreme heat, far-left and far-right parties have both accused recent governments of failing to prepare enough. Former Prime Minister Elisabeth Borne rejects that criticism.
I believe we've begun the adaptation process. We're obviously not at the end of the road yet. I think these reactions are once again more about political posturing.
France's hottest day on record has passed, but the death toll is expected to rise further. And a new heat wave is already forecast for early July.
Well, to talk more about this story, Professor Antoine Flahault is with me. He's an epidemiologist who works between Paris and Geneva, including at the Bichat hospital in the north of Paris. Hello to you, and thanks for taking the time to talk to us today. First of all, Bichat then, it's a public hospital. Give us a sense of what conditions have been like there during this heatwave.
In fact, most of the hospitals in France are not equipped with air conditioning. Bichat is a bit different because it is a more modern hospital. However, most of the hospital beds are not equipped today with air conditioning, and they have reached high temperature in these rooms in several occurrences during the past weeks. Nowadays, today exactly, it's the weather is a bit cooler in Paris, particularly, and in France. But for a couple of days, it was very, very, very hot, even in hospitals.
And we will talk about air conditioning. You mentioned that is not available in a lot of hospitals. I want to ask you about that in a moment. But first of all, from what you have seen or from what you've heard from your colleagues, beyond AC, has this heat wave meant that equipment in hospitals hasn't been working properly? Have people had to cancel operations because of the number of people coming in with heat-related issues?
Yes, in fact, the authorities have decided a couple of days ago to postpone all the operations and all the hospitalizations which were not for emergency, and so they secured with these regulations, they secured hospitals to welcome this overwhelming number of patients coming from their home or from sometimes their home facilities. So for sure, hospitals were overwhelmed. However, it was a bit better prepared than during the 2003.
In what way is the situation better? Because we've seen the government come under significant political pressure by parties from the left and the right who say actually the government hasn't done enough to make the country ready.
Yes, I think there's still a missing point, which is equipment in air condition. We have now clear evidence that air conditions can reduce dramatically, at least by 40%, the mortality which occurred in hospitals during heat waves. And probably also air conditions in home, in domestic home, is also a major factor for reducing mortality during heat waves. And France benefits from highly decarbonized electric energy. So it can now equip all his hospitals and all his retirement home with air condition. That will be something, I think, which is now a consensus among most of the political parties in France, that we need this equipment in air condition in hospitals, in schools, in home care facilities, and so on. And probably also in many domestic homes, particularly in the most vulnerable segment of the population, elderly and poor people.
You're saying there is a relative consensus then that it's time to introduce AC in hospitals, in schools, etc. That is something that can't be done quickly on a national scale. There is a new heat wave, we're told, forecast for just a few weeks' time, early July. Are there any short-term measures that you think now we can take to try and keep the public safe ahead of that?
Yes, we have seen change in behaviors with 2003. In 2003, the healthcare workers were not aware of the good behaviors. For instance, closing the windows during the day because the heat comes in the rooms. It's something they do not do anymore now. They know that they have to close the rooms. They know that they have sometimes to close also the windows, but not only the windows, but also to make the shadow as much as possible in rooms for their patients. So they have some behaviors regarding dehydration. They give water, they give salt, they give also, they feed much better their patients and the elderly people in particular, even during the night. So there are some fans also can be used, and so there are some new habits or old habits which can be renewed, and good practice which are more spread now than it was before. Of course, as I mentioned, we need and we are looking for air conditioning, which will be a much better and easier solution.
All right, Professor Antoine Flahault talking to us there, epidemiologist here in Paris and in Geneva as well. Thank you very much indeed for your time.